Welcome back, everyone, and I hope you're all feeling refreshed and ready for a fascinating afternoon ahead. So to start, we'll be kicking off with our Fellows of the Future competition. Now, this competition is something that's particularly close to my heart, and I'm delighted to be welcoming our brilliant finalists up to the stage to share their work. They're all absolute winners. Before we begin, I would like to start by providing you with a bit of context about the competition. Now, one of the fellowship's remits is to use its accumulated knowledge and reach to inspire all parts of the profession, including those currently studying veterinary medicine. To this aim, the Fellows of the Futures competition was established to encourage students and graduates currently involved in research projects to share their work. Undergraduate and postgraduate students and recent veterinary graduates on the RCVS register are all invited to enter. This year saw many applications being submitted, and the judges have shortlisted 3 finalists to speak to us today. Each student has just 5 minutes to present the research and a further 2 minutes to answer any questions from our panel of judges. And alongside myself, today's judges are Dr. Rachel Dean, Professor Christopher Lochray, and Mrs. Pam Mosdale. So to decide on the winning presentation, our panel will be judging against a number of criteria, including originality, contribution to scientific knowledge and understanding, knowledge of the subject material, and quality of the presentation and delivery. So the winning and highly commended presentations will be awarded £200 and £100 in National Book tokens, respectively. So let's make a start. So first up, we have Laura Huntenberg from the University of Liverpool, who will be presenting her work on progressive methods of reducing lameness in the UK sheep industry, a study in the use of thermal imaging as a diagnostic tool to identify sheep foot lesions. So over to you, Laura.
Hello, I'm really happy to be here. So yes, I'm Laura, I'm a 4th year vet student at Liverpool and a self-confessed sheep fanatic. So the heart of this study really was looking at supporting farmers with progressive methods to try and reduce lameness. So so why lameness? We've got to think about why. Why is this so important? So according to HDB stats in 2020, lameness can cost UK sheep farmers around £28 million a year. There are lots of welfare implications as well, pain and discomfort of the animal, alongside lots of production concerns as well. So there are lots of different causes for lameness, but then the 3 that I will focus on will be the infectious diseases. So looking at ID, cod and foot rot, as you can see from the images there, the pathological lesions, and really looking at how we can reduce numbers of this in the flock and hopefully treat early to stop spread of infection and trying and kind of make things a lot easier for the farms. So why thermal imaging? So we're trying to investigate ways that we can reduce the lameness or reduce the infectious disease before clinical signs show. Sheep are so stoic and they'll put up with a really high level of pathology before we actually know there's a problem. So really, again, why do we want to do this study? Was so that we can try and nip things in the bud nice and quickly, treat early and prevent ongoing long-term problems on farms. So this work was alongside a PhD project at Liverpool that I was very lucky to assist on and just kind of help handling the sheep. And it's looking at cod specifically, looking at creating an ELISA test and hopefully a vaccine in the future. So we were on farm for a very long time, looking at spending time with the sheep. But I just picked a small selection. So I had 4 farms as part of this study and looked at 80 sheep, 15 of which were the control group and the rest were cases. Okay, so the methodology. So we went into farm with a group of vets as well. All of the sheep were assessed for their lameness or mobility score, and And then we selected those lame sheep to have a look at, identify the lesion first and foremost. The farms themselves were self-selected, so we put posters up in marts for them to say if they had marts, vets, they were referred by vets, and then when we visited the farms, we then selected the animals. So most farms had at least 500 sheep, and we asked for them to have at least 30 lame sheep as part of the bigger flock, just so that we could get a good big sample size. So when we were on farm, like I said, we mobility scored using a 0 to 3 mobility scoring system, and that was done by the same person each time. We then identified the lesion of the sheep. As part of the greater project, we took swabs and blood tests, and we cleaned the hoof, and we just spent a lot of time with the animals, sort of 10-15 minutes. Before all of that, we made sure to take thermal images to make sure that we didn't interfere with the results of the temperature of the, of the hoof, if we were rubbing it a lot and creating more inflammation. Then we took 2 images, at least 2 images of each hoof, with a lesion. So one plantar view to get an image of the sole, and one image at the front of the hoof so we could look at the coronary band as well as the interdigital space. And that is based on the pathology of those infectious diseases. And then we were going to use those images to try and determine a relationship between the temperature of the hoof and the specific lesions. We used a FLIR infrared camera on that, not the most practical on farm, but is handheld. And then we used the Align software to measure the different temperatures at each of those regions. And we compared each group, like each infectious disease group, with the control group afterwards. We also took the ambient temperature, because this data was collected over a long period of time, and our summers obviously fluctuate massively in temperature here. We were sampling in sheds, we were sampling outdoors. So when we were comparing the temperature changes, we removed the ambient temperature from all of the readings to try and make it uniform. Finally, we analysed the results. Apologies for the worst graphs ever, I will just talk you through them. So we analysed, so up at the top, I've got a pointer. This was looking at the coronary band minus ambient temperature, and that is, so this dark blue box here is the temperatures for cod, then orange is foot rot, ID, and the control group. Moving on to the sole temperatures, and then the interdigital temperatures as well. Then we compared the mean temperatures of each of those areas for each lesion and compared it with the control group. And of course, comes to no surprise, there was a significant difference, and we saw humongous increases in temperature for those infectious diseases at each area. Significantly cod, I think we saw at the coronary band, there was like an 88% temperature increase with compared to the control group. And it was significant across the whole of the data set. And then again, similarly, here foot rot was 73% increase, and then ID was a 49% increase. And that's just at the coronary band, which is very highly vascularized, and you're going to see lots of inflammation. When I compared the means, I also did a t-test to try and compare and see if it was significant. And we did see our p-values were very, very much below 0.05, which showed us that we can confidently say it is significant that our temperatures are, our mean temperature of these different lesions are significantly increased over our control group. So all of this is great, but the thing that's, that I find really important as part of the study is what does it actually mean? What can we do in the future? So we can say, yes, thermography, using the thermal images, we can detect these temperature increases, and hopefully with more data, more research, align them specifically to different lesions. And that's great, but useless unless we can actually use it on farm. There's so much technology out there now in the world. Hopefully one day I'd like to see something incorporated into races or into pressure pads that sheep can walk on. Things that are practical for farmers to use and not having to bulk around a great big infrared camera, but is there something more portable they can use during shearing, during vaccinating, and then hopefully lead that on to detecting lesions earlier, treating more effectively, using less antibiotics in the long run, and also having much greater production values as well. Thank you very much.
Thank you very much, Laura. Well done. That was super. Now it's now over to our judges. Do you have any questions for Laura?
Thanks, Laura. That was great. And it's great to meet a sheep fanatic that actually wants to know what data means in real world. So thank you for sharing that. I was interested in the bit that you said at the end there. So with the different diseases, were the sheep that you took thermal images of at different stages in terms of clinical presentation? And does that explain some of the variation in your box and whisker plots?
Absolutely, yes. And you know what, if I had all the time and the money in the world and I could spend more time, we could narrow it down even further. So for the cod group, for example, we did write down, you know, we took a note whether it was, you know, which grade of cod it was, 1, 2, 3, or 4. And as well, we have the real-life images as well of the hooves themselves, so we can see the severity of the pathology. Some of them were healing, and it might explain some of the kind of discrepancies in those temperatures as well. There is also a lot more data. Like I said, I only selected 4 farms for this. We visited about 30, so I'm hoping that, you know, in the future there's scope to delve into that. The other interesting thing is that we, as part of the other project, all of the feet were swabbed, and they're doing some like lab work, genomic testing to find the bacteria within, you know, each of these lesions. In some of the control groups on those farms with active cod lesions, active foot rot, that bacteria might already be in the hooves. There might be some preclinical signs, you know, sheep with low-level pathology without showing clinical signs that might have that bacteria. If we could then go back and have a look at the thermal images afterwards, that would be really interesting to see at what point, or at like tracking that kind of rise in temperature, hopefully, to make it quite useful, yeah.
Fab, thank you. Have we got time for another?
Time for one more, perhaps?
Hi, really nice talk. Thank you very much. I wonder if you kind of alluded to it at the end, but I wonder if you can expand upon how you would scale this up to an industrial scale.
Yeah, you know, this is it. I wish I was an engineer. I'm not sure. It's really difficult, isn't it? I think there is, like I said, what would be, you've got to come from a point of what's practical for the farmer. What are they already doing that we can slot this into? And I think within handling systems, within races, if there was something like a camera alongside the bottom of the race, maybe, I'm not sure how feasible it is, to be honest with you, but if that would be amazing. Or again, in the pads, like if there was like thick pads or pressure pads or something underneath where they walk on before going to a foot bath, if that had some sort of thermal detection in to look at the sole, if it was something, if there was like a smaller kind of handheld thermal imaging device that could be used to scan during shearing, or that might be useful, but it would have to be something that would be accessible and easy for farmers to use, because they're so time limited as it is, and it's got to be practical for it to work and for it to be done properly as well, because, you know, if it's difficult and a bit of a burden, it'll just get left to the side or not utilised properly. So yeah. Thank you.
Thank you, judges. Thank you very much, Laura. That was outstanding. Well done. Thank you. Now, next up, I would like to introduce Joycelyn Internat from the Royal Veterinary College, who will be presenting her research on patient benefit and factors associated with technique success of sentinel lymph node mapping via indirect computed tomography, lymphography in small animal oncology patients. Okay, Joycelyn, thank you.
Good afternoon. Thank you very much to the RCVS for this opportunity to present today. My name is Joycelyn. I'm a final year veterinary student at the Royal Veterinary College, and for my final year research project, I wrote about factors associated with technique success in using sentinel lymph node mapping via CT in small animal oncology patients. This project was written under the guidance and supervisor of Dr. Andy Yale, who's also at the Royal Veterinary College. So what is sentinel lymph node mapping? Sentinel lymph node mapping is essentially a technique that is used for the purposes of tumor staging. It aims to identify the first lymph node that receives lymphatic drainage from a tumor, and this is consequently predicted to be the first site of metastasis. This is a factor that holds great value in the diagnosis, the treatment, and prognosis in both human and small animal oncology patients. As shown by image A, it was previously assumed that lymph nodes anatomically closest to a tumor were sentinel, and therefore sampling was undertaken on the presence of regionally enlarged lymph nodes. However, we now know that this is an insensitive criteria, and as shown by image B, lymph nodes that are further located from a tumor, or those that were previously in overlooked anatomical areas, may still harbor the lymphatic drainage from a tumor. Not only does this technique decrease patient morbidity by increasing the accuracy of lymph nodes sampled, but it further builds upon the traditional practice of regional lymphadenectomies, which at times can be quite extensive. We can ultimately allow for greater patient quality of life by achieving more accurate preoperative surgical planning, as well as extirpation of the correct sentinel lymph nodes. The value of this technique is further shown on this slide. Image B shows a canine patient that was presented with a mast cell tumor located on the left ear base. Following injection of contrast agent around peritumoral areas, we see that it drains through the afferent lymphatics, where it drains into the left prescapular lymph node, and this was identified as the sentinel lymph node. However, if we were going to initially be looking at the regional lymph nodes of interest, this could have included the bilateral parotid, retropharyngeal, or prescapular lymph nodes. Because we've already identified the left prescapular lymph node, however, as sentinel, we no longer need to extensively sample these other nodes, nor do we need to surgically remove them for further investigation. This was a retrospective study undertaken at the Royal Veterinary College from 2019 to 2024. 50 tumors from 39 dogs and 6 cats were used who presented with either cutaneous, subcutaneous, or oral tumors. Tumor presentation was divided into primary tumors, recurrent tumors, or scars. And data that was collected and used included the final diagnosis, tumor location, the predicted anatomical draining lymph node, the presence or absence of regionally enlarged lymph nodes, and whether a sentinel lymph node was successfully identified, and if so, which. Mast cell tumors were the most commonly presented tumor type, followed by melanomas and squamous cell carcinomas. Regarding the results of this study, a sentinel lymph node was successfully identified in 82% of tumors. No significant association was found between technique success, species, histotype, or tumor presentation. However, as shown by the table below, tumors that were located on the head and neck actually showed a significant association with technique success when compared to those located on the trunk and limbs. This is actually an expected finding due to the extensive layout of lymphatics in the head and neck region, which would have ultimately increased the frequency of detection. The clinician predicted draining lymph nodes were further compared to the actual sentinel lymph nodes which were identified, and they're shown in the interleaved bar graph at the top of this slide. In total, a total of 28 patients were considered to have benefited from this technique, as it highlighted additional, fewer, or completely different lymph nodes to sample. In patients where fewer lymph nodes were found, this actually decreased their morbidity, as it meant that fewer lymph nodes needed to be sampled. And in those where additional or completely different lymph nodes were found, this meant that clinicians were able to investigate lymph nodes that might have previously been missed without the use of this technique. Additionally, in 2 patients, metastasis was actually identified in lymph nodes which would have been missed without the use of sentinel lymph node mapping. So what are the implications of this study? Essentially, it shows that sentinel lymph node mapping is a very valuable technique, as it highlighted critical diagnostic information that otherwise would have been missed, and it ultimately allowed clinicians to give the appropriate treatment as well as monitoring for patients moving forwards. Its high success rate further makes this a reliable technique, as shown by the success rate of 82%, and it can be used in both canine and feline patients, as shown by the lack of significant association between technique success and species. Cancer currently remains one of the leading causes of death in small animal patients. Therefore, further interest in this technique is expected in the future, including long-term follow-up of patients who were staged to assess whether they truly benefited, or perhaps for other studies that may look for other factors that influence technique success. Thank you very much.
Thank you very much, Joycelyn. That was terrific. Thank you. Now, over to the judges. Do we have any questions?
Hi, Joycelyn. That was a great talk. Thank you very much. There's a lot of renewed interest in the lymphatic system from things like organ regeneration particularly. I wonder if you've thought about how you could use your diagnostic imaging technique for other areas of science beyond staging of tumours.
In terms of, I think in general, it kind of broadens our knowledge, not only for the purposes of tumor staging in animals, but also in humans. For example, I know that this is a technique that is very commonly used in breast cancer patients because regional lymphadenectomies have been associated with things like increased pain, edema, and in animals also lameness, loss of nerve function. So I think as an umbrella overview, it's really used to decrease the patient morbidity and overall be used to increase the patient quality of life.
Hi, that was great, thank you. I just wondered, for those of us who wouldn't be able to access this imaging, would there be any, in the future, would there be any way that you, for vets in practice, that you could provide them with the usual sentinel lymph nodes or whatever, or are they completely different depending on the tumour? Are there certain ones for certain areas? And does breed have any implication when it comes to dogs? Would they be different in different breeds of dogs, do you know?
Mm-hmm. Regarding different breeds of dogs, in this population, mixed breed dogs were the most common breed presented, and that was one of the limitations of my studies, that I wished I had a bigger sample size, or if I had a bigger sample size, maybe you could find if there was significant association in different breeds, and that applies to a lot of other categorical variables that I was investigating. In terms of whether this technique will be available to more practices, I'm honestly not too sure if that currently exists. I do believe this is a technique that is currently done in more tertiary referral hospitals just because you have access to things like a CT, a specialist referral center who's able to provide the knowledge, the expertise. So I'm not too sure, to be honest, but I hope that in the future maybe you will have more accessible means of this.
Thank you very much. That was terrific. Thank you very much, Joycelyn. Superb. Finally, I'm delighted to introduce Hannah Shanks-Boone from the University of Liverpool, who will be presenting her research project entitled Increased Soft Palate Angle in Basohyoid Depth is Related to Increased Body Condition Score and Increased Tongue Size in the Horse. Thank you very much.
Hi everyone, so my name is Hannah. I'm a final year at the Liverpool University, and today I'm going to be talking to you about my third year research project. Increased soft palate angle and basohyoid depth is related to increased body condition score and tongue size in the horse. Before I start, I'd like to thank the RCVS for the opportunity to speak today. Thank you to my co-authors, Chris Baldwin, Hattie Barnes, Tom Alex and Alison Talbot. Also, congratulations to Tom and everyone else on your fellowships. The study received ethical approval, all owners gave informed consent, and there were no sources of competing interests or funding. So, equine obesity is a growing concern in the UK, with owners less able to identify obese horses. In 2018, the prevalence of equine obesity was estimated to be between 30 and 50%, with a higher prevalence in at-risk groups such as non-ridden horses. Obesity is well known to increase tongue fat in humans, and this in turn increases the severity of obstructive sleep apnea. And there's also been investigations into the role of obesity and increasing risk of brachycephalic obstructive airway syndrome in pugs and bulldogs. This is the first published study looking at the effects of obesity on the oropharynx of the horse. So given the effects of obesity on the oropharynx of humans and dogs, this study aimed to investigate a potential relationship between increasing body condition score and measures of the tongue and oropharynx. So 58 horses who had a head CT scan and a body condition score recorded at the University Hospital were included in the study. Exclusions were then made for pathology of the region being investigated, non-pathological factors such as an ET tube displacing the tongue, or CT factors such as movement distorting the image. Following these exclusions, 44 horses remained within the study. All CT scans used had standing IV sedation with the head and neck in maximal extension and the mandible flat on the table. Body condition scores were done by one experienced assessor. 6 measurements were then taken from the midline sagittal CT of the horse, which can be seen here. Each were repeated twice, and these include head length, which was estimated to be from the nasal bone to the occipital protuberance, tongue area, dorsiventral height of the tongue was measured in 2 places, so at the level of the caudal hard palate and at the rostral-lingual process of the basihyoid bone, soft palate angle and basihyoid skin depth. All statistical tests were then carried out with a 95% significance level. So of the 44 horses included in the study, there was an age range of 21.5 years, with the median age being 12. Male and female horses were included, and there was a range of breeds. Body condition score was normally distributed, with 3 being the most common score. And none of the horses in the study had any history of upper respiratory tract conditions. Age and sex had no significant effect on any of the measurements. However, there was an association between increasing head length and increasing measures of the tongue, so all further statistical tests were carried out with tongue measures as proportions of head length. Graphically, it appeared that an increasing body condition score led to an increase in tongue size, but there wasn't any significance to this finding. There was, however, significance that an increasing body condition score leads to an increased soft palate angle, which we can see in the graph on the top left. There was also a significant correlation between increasing body condition score and increasing basihyoid skin depth. So horses that are more obese have a more dorsally resting basihyoid bone at rest. There was also a significant correlation between increasing tongue size and increasing soft palate angle at all 3 of the locations measured. There was also significance between increasing dorsiventral height of the tongue and basihyoid depth. However, it's expected these were probably both linked to body condition score rather than one causing the other. So the limitations of this study include all measurements being taken in a single plane. There was a lack of blinding to the person taking CT measurements to their body condition score, and there was no investigation into the role of breed due to insufficient cases in each breed group. There was also an uneven body condition score. As expected, most horses fell within 3 and 4 categories. Further work into this area may involve a larger sample size, directly measuring fat within the structures of the oropharynx and the turn, and the effect of these findings on the role of upper respiratory tract conditions, such as dorsal displacement of the soft palate. So to conclude, an increased body condition score leads to an increased soft palate angle. Increased body condition score leads to an increased basihyoid bone depth, meaning it sits more dorsally at rest. Increased tongue size at 3 locations leads to an increased soft palate angle, and increased tongue size at 2 locations leads to an increased basihyoid depth.
Thank you very much. Thank you, Hannah. That was brilliant. Now, back to the judges. Do we have any questions for Hannah?
Yes, thank you very much, Hannah. That was great. In small animal practice with the brachycephalic dogs, we tend to have different anaesthetic protocols sometimes and different ways of dealing with them. With this, what you found, would that mean that overweight horses should be dealt with in a different way when it comes to anaesthesia, do you think?
I think potentially, in this situation, all the horses had the same protocol for their sedation, so it's uncertain as to whether that could change anything in their airways. Potentially, it could lead to it. The majority of the application of this is with the possibility of, so obese show ponies going around with their heads in flexion, is their palate more unstable because they have a greater soft palate angle. I'm not entirely sure whether it would have an impact on any sort of general anaesthesia protocols, but it would be interesting to investigate into that.
Thank you.
Is there any kind of plan to see whether you can see these changes when you see changes in weight of the horse? So is there potential, do we think that if the fat show ponies with a flexed neck lose weight, that this might improve?
We have just started a study of trying to get some horses to lose weight and seeing if it changes anything. So hopefully down the line there might be something to show whether it has any link.
It's quite tricky to get horses to lose weight, I'm told. I don't know anything about horses, but I'm told that sounds quite tricky. And is the intention to do some follow-up scans with that?
Yeah, I'm not sure about CT scans as well as scoping them to see what happens when they're moving, because obviously all the horses were sedated in this. So to see if it's got any dynamic effects on anything.
Thank you.
Okay, thank you very much. That was terrific. Thank you. So thank you to the judges for the questions, and thank you and congratulations to all our Fellows of the Future finalists for sharing your work with us today. Now we'll be announcing the winner later on, but as I said before, you are all winners. And I am constantly amazed at the confidence and the depth of these presentations. And every time I hear you guys give presentations like this, I know our profession is in very good hands, so thank you very much. So I would now like to invite you all to make your way to the panel session discussions. And in the council room, we have Preparedness for Disease Threats, which is being chaired by Professor Anna Meredith, Chair of the Fellowship Science Advisory Panel, and guided by panel members Dr. David Black, Dr. Tiffany Hemming, Professor Fiona Tomley, and Professor James Wood. In the Brunel room, we have Community Resilience for Emergencies and Disasters, and this will be chaired by myself and guided by panel members Mr. Jim Green, Dr. Adam Mogford, and Nicola Houseby-Skeggs. When you signed up to attend Fellowship Day today, you'll have been asked which session you wish to attend and have been allocated a session accordingly. So hopefully you should all know where you're going, but they're downstairs and there'll be folks sort of pointing in the right way. So after the discussions at 4:15, we'll reconvene back in here for the results of our Fellows of the Future competition. So thanks very much. Thank you, guys. Thank you.